Okay, and so I think she's asking if these people, because of their Olympic class training and whatnot, are diagnosed more often than maybe other people who are triggered due to the extremes of their athletic competition. So,
well, I think it may be a plausible hypothesis that someone who is exerting themselves to the extreme may experience more chest symptoms than someone who's just sitting on the couch. So I think that, that makes some sense. But I don't know of any biological reason why someone who's an athlete would have asthma as opposed to someone who's not an athlete. Unless there's some exposure, like some of the winter athletes may be outdoors in the extreme cold weather, and that can definitely trigger some symptoms of asthma, as well as people who swim frequently can sometimes develop a sensitivity to the chlorine because they're inhaling the chlorine. So there may be some environmental factors that play into that. Otherwise, I can see if Carl has anything else.
Well, I'll just give two peripheral points. I'm not sure if it's completely addressing your question, but one thing you may or may not know is that exercise is a very potent trigger for most people who have asthma. So that's an important question that we always ask people whom we're considering asthma as a diagnosis. The other point that I think your question partially alluded to is the fact that with modern treatments, even people who may have been the scrawny little Teddy Roosevelts back at the turn of the 20th century now can perform at Olympic levels and still be able to compete. And so that's a testimony to a lot of the newer advances and treatments that we have available to treat people with asthma. Just again as a peripheral sideline, compared to when I was doing my training back in the 80s, we had untold numbers of hospitalizations and not very good treatment, and people sitting out in the emergency room with breathing machines and all this sort of stuff. And these days, I've not been called into the hospital, and I know children's may be a little bit different, but I've not been called into the hospital to see one of our asthmatic patients in several years. So there really have been tremendous advances that would allow somebody to compete at the Olympic level who have asthma.